Well, first, I want to thank the organizers for OIS for having this meeting today live. It's good to see everyone in 3 dimensions again. Spend too much time seeing clavicle up for everybody, and now we can see everybody again with the smiles in live vision. Also want to encourage everyone to just shift your mindset for a second. We're going to be talking medical device now, and I know that's a big difference. It's our first time presenting here at ASRS, the improvements we've made to our technology, so it gives us great pleasure to talk about it. I speak today on behalf of our team, a growing team, a team that's developing in its experience in ophthalmology. We've crossed the 200 years of collective experience in ophthalmology, including our commercial teams around the world and our leadership team in New Jersey. Samsara Vision is bringing the Sing IMT to market around the world and to trial in the United States, looking for approval with our second generation technology to come to market within the next couple of years in the United States, as well as commercializing around the world today. We bring this device to patients with late stage AMD and those patients suffering from this, about 11 million patients around the world, 4 million patients today on label, but we look to make label expansions as we bring the technology around. Now, I know this room has a history and understanding of the original technology, the original IMT from Vision Care, and we maintain the same central optic, so the true Galilean telescope optic that was familiar from the first generation technology that was implanted in over 700 patients around the world, which brought a dramatic quality of life improvement to these patients and big vision gains. We see that in the results of our first generation technology FDA trial, 3 and 4 lines of vision gain, 75% of patients had 2 lines vision gained, 60% of patients received 3 lines vision gained, and really an exciting number, 40% of patients got 4 lines vision gained with this technology, and that correlated into strong VFQ scores. And we've been able to watch these patients now for 5 years and see that retention of vision happen over the 5-year period with the technology. So the question that I had taking on the role of CEO of the company was why didn't this technology have a broader base of uptake? And you see that here from the depiction of the surgical procedure. The surgical procedure was cumbersome in nature, 12 millimeter a cornea incision for delivery, at 8 millimeter capsular rhexis, 25% ECD loss, made it very challenging for any surgeon, even the top cornea surgeons around the world. You can see the picture, I think, says 1,000 words, a manual cornea lift and a manual implant of the technology. What was not easy to do and led to trauma that really took the patients 1 to 3 weeks to overcome and generated more than 60 minutes in the OR, diluting the value of the strong reimbursement that the technology had. So the company took a pause several years back and decided to focus on development of a smaller incision, new generation IMT, or a Sing IMT, and bring that to market under this brand name. And here you see a picture of the new design. You can see this also in video. We just had a Miyake video. Professor Gerd Ofarth in Germany did a very nice video from the posterior view of the insertion. You can see that on our LinkedIn page that was just posted today in time for ESCRS. It's a true Galilean telescope, same central optic design as the original technology, but now with 3 foldable black silicone haptics for ease of delivery. Here's the comparison between the 2 generations. Generation 1, the 12 millimeter incision was very prohibitive and caused a lot of trauma. We've reduced that now to 6.5 to 7 millimeters. The rhexis is now a standard capsular rhexis for cataract surgery, so 5.5 millimeters as compared to 8. The 11 sutures postoperatively have been reduced down to 3, making this easier to do for any surgeon around the world. Procedure duration is now cut in half. We're averaging 28 minutes for the procedure, where we were greater than 60 minutes previously. In line with a similar cataract surgery, it's not much more challenging than that. 7 to 21 days post-operative trauma period for the patients in the previous design has been reduced to 1 to 3 days. And that are patients that have gotten the smaller incision technology have reported a more motivated, we've seen a more motivated patient going into the post-operative vision therapy sessions after the procedure. The ECD loss, probably the best part of this is looking at these ECD loss. The 25% we experienced in the original design is now averaging 7.8% for our clinical patients in Ireland. We've done 9 so far clinically. Here you see Professor Keegan was the surgeon that did the first 9 patients. This is part of our submission, our IDE for the FDA trial that we have coming up. Patient response is very similar to what we saw in first generation technology, which those patients that had a great experience, you see everything from writing a book about their experience with the technology. Jim Hinman, the former CEO of Jiffy Lube, we were honored to have him write a book about his experience. I think my favorite quote here is Professor Albert Augustine on the bottom left did a commercial case in Germany not too long ago. And he said the new procedure is very easy and fast. That's the best compliment I think we can get, where people aren't talking about the great lengths they have to go to implant the lens. It was just really simple experience. Now, in terms of practice economics, we retain in the United States $21,000 reimbursement from CMS. So that now that we've reduced the time and complexity of the procedure, that reimbursement is enjoyable in a shorter period of time, and that compares very well to other procedures that are similar in nature. Commercially, we're rolling this out around the world. We've got centers of excellence trained in Germany, Australia, where we've got submitted our for approval in Korea, Taiwan, all throughout Asia. We're looking to do our first procedure in Canada shortly, and moving around Europe in steady fashion as we commercialize. In the United States, we require an FDA PMA supplement trial based on our original technology. We're in the process of recruiting those 20 sites that you see on the slide. We think 100 patients will be relatively manageable in terms of a study, and we look to do that in the beginning of next year. And we're developing tools based on modern technology, digital technology, to help the patients throughout their journey. So day of surgery is only one part of this equation, but finding the right patients for the technology and then doing the therapy sessions post-operatively can be assisted by the digital technology that we have today. And we're looking to build those tools for these patients as we go through. So that's it. I want to thank you for your time today, and want to also offer time at any break if you have any questions on our process or progress. I'd love to see you in more than just 2 dimensions here at this conference. So thank you.